Before you begin this or any exercise program, please consult with your personal physician. If you're under a physician's care for a medical condition, discuss this program with him or her before you begin. Remember that regular medical checkups are essential for your health and well-being. And while this exercise program can help you grow stronger and become more physically active, it cannot replace the advice of a healthcare professional who knows you personally.
Hi, my name is Scott Crawford, and this is Get Fit with Fire Seniors Edition, brought to you by the Mesa Fire and Medical Department. It's well known that tremendous health benefits can be achieved with even low levels of exercise. So the Mesa Fire and Medical Department is taking a proactive approach to emergency calls by focusing on the reason for many of our medical calls, health and fitness. During this program, we will help you improve strength, reverse age-related muscle loss, and improve your overall health. So if you're ready, let's go inside and get fit with fire. If you've been able to accomplish all of our other episodes, then it's likely you've seen improvements in fitness and health. And now it's time for an additional challenge. So if you're ready, let's get started. Our first warm-up is going to be our heel to toe. So we're all going to turn to the left, get in a heel to toe stance. Imagine we're walking on a tightrope and we're just going to walk heel to toe. Nice and stable. Remember, just walk as much room as you have in the room, and then once you get to the edge of the room, we'll turn around and go the other way. So let's all turn around, go back the other way. Remember to keep your shoulders nice and stable. Back straight. And when you return to your starting position, we're going to move on to our grapevine. So just like in the past, we're going to step in front and then step behind. The difference being, we're going to do it with a little pop in our step. So we're going to go front and behind, keeping our shoulders square, our hips square, turning at the waist. So if we're all ready, let's go to the left and go. Good. And when you get to the edge of the room, go the other way now. Right back. Good. That's going to loosen up our hips, get our blood flowing, and get us ready for our exercises. Remember, 3 to 5 minutes of warm-ups. You can incorporate any type of warm-up into your exercise program. These are just a couple examples for you. Our first exercise is going to be a combination lunge. What that means is we're going to step to the front in our front lunge position, then we're going to return to our starting position, and on that same side, step to the rear. Return to the starting position, and that'll be 1 repetition. Everything's going to happen on our left side to start with. So if we're ready, we're going to do 10 repetitions of our combination lunge. Here we go. So out, starting position, back. Return to the starting position. That was 1. Nice and slow and controlled. Don't be in a hurry to do this. Take your time. Make sure that every repetition, you're nice and stable before you move back to the starting position. And remember, that front knee should not be going out over the toes of our shoe. That puts too much stress on our knee. Keep your back straight and don't lean out over the front of your front leg. Good. And excellent. Let's move to the other side. So the same thing, this time on the right side. And here we go. Out to the middle, back to the middle. Good. Make sure you inhale on the way back to the starting position, and you exhale when you move into either that forward or that rear lunge. Good. When you lunge, you want to step back far to the rear and Debbie, that's good. Keep going. Forget it. She's doing fine. And try not to let that knee touch the ground. Just look at everybody else. There we go. We're doing great. And our last one. Good work. That's it. Our next exercise is going to utilize our exercise band. It's going to be a standing leg press. We're going to start on the left side. And to do this exercise, we're going to take our band and step on it so that the band runs underneath our heel. We're going to grab it with two hands. I'll demonstrate one for you. And so what it's going to be is raise up and then push down against the resistance of the band. Make sure you're nice and stable on your right side while you're doing this exercise, and try to keep your shoulders nice and square, back straight. If we're all ready, we're going to begin on the left side with 10 repetitions. Here we go. Up and down. Up and down. Nice and slow, controlled. If we can, just try to tap that heel to the ground, maintaining most of our weight and balance on that right side. Don't forget to breathe. And just one more. Good. Let's switch to the other side now. So now we're on standing on our left foot, exercising our right. We're all ready. Pull that band up nice and tight, get some resistance on it, and up we go for one and down. Let that band really pull our hip up high and then push against the resistance. If you need to, you can hold onto a chair while you do this exercise, if that would help, if you're a little bit unstable. Remember, anytime we're exercising, particularly with these balance exercises, make sure you have the right footwear on and it's securely fastened. We don't want our foot moving around inside our shoes. Good. That was 10 on each side. Now we're going to move to what we call a standing gait opener. This doesn't require a band, so what we'll do is we'll all stand on the left side of our chair, and if we need to, we'll hold that chair for balance. We'll raise up on our right foot, we'll open up our hip, and then we'll return to the starting position, just like so. As slow and controlled as we can, but only raising up as high as we're comfortable. So for some of us, we may not have a lot of good range of motion or mobility in our hip, so it's okay just to come up a little bit, open up, and then return. For others, we might be able to get our knee up really high, open up really wide, whatever's comfortable for you. But over time, you'll probably find that you're going to increase your mobility and range of motion in that hip, and that's what we're trying to achieve with this exercise. So if we're ready, with our left leg, let's go up, out, back, and down. Good. Up, out, back, and down. Good. Just coming up as high as we can, holding the chair if we need to, just for a little balance. And really what that does is it allows us to really accentuate the opening up of our hip. You can see that if we're not as concerned about our balance, we're really able to open that hip up. And opening that hip up is what's key to this exercise. So don't be afraid to use the chair for balance. Good. And that was 9. One more and we'll switch to the other side. Good. Let's walk around the other side of our chair. And we're going to do 10 on the opposite side. So just like before, get nice and stable on your left leg before you try to bring that right leg up so that you don't fall. Use the chair if you need to. Here we go. Raise up, open, back, and down. Up, open, back, and down. Up, open, back, and down. Good. Your shoulders are nice and square. You're looking forward. The only part of you that's moving is just that hip area. And by doing that, it's going to strengthen the hip. It's also going to increase that mobility and range of motion. So if we were to suffer a fall, we would be able to resist injuries that commonly occur from that fall much easier than if we hadn't done this exercise in the past. That's going to be 10 right there. That's it for the lower body exercises. We're going to move up to the upper body, and we're going to use our band for all of these exercises. Our first upper body exercise is a chest press, but unlike in the past, when we've done our chest press where we've had our elbows out to the outside, we're not going to do it this way. We're actually going to pull our elbows nice and tight. We're going to push out just like before, then we're going to allow those elbows to track back in tight to our sides. So if we're all ready, let's begin with 1, 2, nice and slow and controlled, 4, make sure we exhale when we push, and that we inhale on the way back in. 2 more. And our last one. Great. Let's do a shoulder raise now. This time we're going to do what we call a 180-degree shoulder raise. So, on our left side, standing on the band, we'll grasp it just a little bit in front of us so that we have just a slight amount of tension in the band. If we can, and without any pain, raise this band up all the way over our head. So that's a 180-degree motion. We're going from the bottom to the top. If at any time we feel some pain or resistance in our shoulder, we want to stop just short of that. But for those of us that are able, we're going to do a 180-degree shoulder raise. So here we go. And up and down. Up and down, slow and controlled. You can have a little bit of bend in your elbow. You don't need to have that elbow locked out. 5, make sure you're breathing. 6, good. Shoulders nice and straight. Focused on the exercise like Debbie is here. There you go. You're worrying me. And last one. Let's stay right where we're at, but just switch our band to the opposite side and do our right side. If we're ready, we're going to get firm on that band. Make sure you're standing on that band so that it's not going to snap out on you. Sometimes when we're not paying attention to stand on that band, it'll have a tendency to pop out on us. If we're ready, here we go. And up, down, up, down. Good. Just a slight bend in your elbow. Good. Excellent. We're doing great. Really good. That's 8, 9, and 10. Everybody's so focused today. These exercises must be hard. I wouldn't know because I'm not doing them all. I'm going to pay for that later. Let's do some downward pulls. To do the downward pull, we're going to raise the band high above our head on our right side. Hold it tight. Reach up with our left hand. Grab it right about our elbow, maybe a little lower. And we're going to pull down and away and across our body. So we should end up right about here with our hand at our side. Then we'll return to the starting position. So if we're ready, let's go for 1, 2, good, 3, follow that hand, 4, so watch your hand the whole way, 5, 6, keep reaching up nice and high, 7, 8, 9, and 10. Good. Let's switch sides. So reach across, change hands, grab your band, and here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Now we're going to do the exact opposite motion. Instead of pulling down, we're going to pull up. So we'll take our band, and it's going to be pulling with our left, so we'll grab it down by our hip or our thigh with our right hand, reach over the top, so our palms facing our body with the left, and we're just going to pull it up, away from that initial hand, and then up over the body. This is where we want to end up, and then back down, just like so. So if we're ready, pulling with our left, here we go. 1, 2, 3. So both these upward and downward pulls, they're great exercises for our shoulders and for our arms. So they're a combination or a compound exercise working multiple joints, and they're an advanced exercise. So remember, like everything in this episode, and 10. You should have progressed to this point doing all of our other exercises before you take on this episode. Let's switch sides. Hold that band tight on the left, pulling with the right. If we're ready, here we go. Let's begin. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Really good. Those are difficult exercises. I'm glad you're able to accomplish them. Now, we're going to have a couple more exercises before we're done today. This one's going to be an elbow extension. So what we're going to do is we're going to take the band and we're going to hold it out to the side. We're going to have a little dip in our elbow, kind of like we're making the letter W with our body. And then from this position, we're just going to extend and then return back. If we're ready, let's go. 1, 2, 3. Good. 4. Excellent. 5. And you can see our elbow staying right where it needs to be. All the movement is right at the elbow hinges, but nothing else moves. This is a great exercise for the back of our arms. Good. And our last exercise for the day is a reverse curl. So we've done elbow curls or bicep curls in the past. This one's going to be a little different because instead of holding our palms forward today, we're actually going to have them pointed in towards our body. Our elbows are going to be tight to the side, and when we pull up, we're not going to let our hands rotate out. So we're going to keep them facing down. So the palms should face down and away with each motion. So that's our movement. And if we're ready, let's begin. Up, down, 2, down, 3, down, 4, good job, 5, keep going, you're almost there, 6, 7, 8, just 2 more, 9, and 10. Great. That's the end of our workout today. I know that if you continue with these exercise programs that we've put together for you, that you're going to increase your balance, your strength, flexibility, mobility, range of motion, and health. So on behalf of the Mesa Fire Department, I'm Scott Crawford, and this has been Get Fit with Fire. Good job.